Cancer is not a death sentence. I didn't know that when all this started, but it has taught me to be brave and get treatment as early as possible. Hi, I'm Connie Chu. I'm 55 years old this year. In 2014, I was first diagnosed with lung cancer stage 3A. I just thought it was a normal bad cough, but it lasted a whole year. I went to my GP and was prescribed some antibiotics. That would help me feel better for a while, but the cough would come back, and it started to come back more frequently. I went back to my GP, who then recommended I get an X-ray. When we got the results back, she immediately informed me that it wasn't as simple as bronchitis and that she would have to refer me to a specialist because the X-ray showed a spot in my lung.
So the common presentations with lung cancer include cough, blood streaks in sputum, chest pain, sometimes a bit of loss of appetite and weight loss. With Connie, the main symptom that she presented with was cough, and she did seek medical attention eventually. So it's really important for us to be very aware of some of these symptoms that we may be experiencing. The sooner we present, the more likely we may have the chance to catch this at an earlier stage. In Connie's case, she was diagnosed initially with stage 3 lung cancer. And in that stage, we still have the opportunity to cure the disease. I think the other thing to also note is that Connie was a non-smoker, and approximately half of our lung cancer patients actually do not have a personal history of use of tobacco. But especially important to note, because there's a common misconception that if you don't have this smoking history, that you're not going to develop lung cancer.
Accepting the diagnosis at the start was one of the hardest parts. I started thinking about why did I get it in the first place? Was it my eating habits or my lifestyle? I couldn't understand what I did to cause it. But once I got over the hurdle, it was about trying to solve the problem, and that meant getting treatment. After the first round of treatments, the doctors cleared me for work, and thankfully, I had a strong support system that helped me keep my mind strong as I was going through everything. However, I underwent 2 relapses within 2 years, despite being stable for almost 2 years prior.
So on the second relapse, the pathology slides for Connie's lung cancer was sent for molecular profiling. Here, we found a mutation that we had a good match to an effective targeted therapy. And Connie has been on this treatment for the last few years. In fact, since her diagnosis in 2014, we have seen many major advances, including new targeted agents, the incorporation of immunotherapy in stage 4 and in stage 3 lung cancer, as well as many improvements in early detection. I think clinical trials provide a rational framework for us to evaluate new developments and new therapies properly. For this to happen, we do need to be able to design these clinical trials in an appropriate way that meets both the needs of our patients, but also needs to meet the standards required of scientific practice.
Throughout the entire journey, the biggest lesson I learned was early detection and a strong support system can really make a difference. If your body doesn't feel right, please go for a check or screening. If you are diagnosed, be brave. Do the best you can, get treatment early, surround yourself with a strong support system. Being diagnosed with cancer is not a death sentence. Listen to your body and seek treatment. Early detection can save lives.